All right, welcome everyone. This is going to be a tutorial on ExoPLAN planning for an implant on site number 20 in the kind of North American tooth numbering system. So this is really the start screen of ExoPLAN, and so we're just going to load our meshes up. So I'm drawing from an older case. This patient had an implant already planned at site number 29, and so we're going to also plan an implant at site 20. So basically, it's just going to ask you up here, the upper jaw. So we'll click on that. And then the next step, it's going to just prompt you to load the CT data. It draws it from the source folder, but you have to actually like find the volume and click on it. Okay, great. So you'll use your right mouse button to essentially adjust the plane that allows you to set your curve. And then setting the curve is pretty simple. You just click on the orange line. You can add new dots. It automatically does that. You can control other dots, and you essentially will set your focus trough here, your focal trough here, how you want it. Basically just in the middle of the ridge, and that's good enough. So I should say this is version 3.0 of ExoPLAN. So we're going to do a CT to mesh alignment. Basically, the mesh is the patient's intraoral jaw scan, and it's asking for lower jaw. I could have double clicked on that also, and that would have been faster. So essentially, it's just a 3-point alignment. To rotate these models, if you're new to this program completely, it's always the right mouse click. So we're going to just select 3 points, 3 similar points. They have to be approximately close, but they don't have to be exactly close. The first, if you click next here, this is just going to be just putting those points together. So this dialog box pops up frequently, and my understanding of this dialog box is basically don't select anything on here. So a lot of times you may have a digital wax up that you're bringing into the case, or you may have a few other casts, and my understanding is basically this tells the computer to bring the CT to the jaw scans and not break the alignment of any of your other scans, so that all of the alignments of your scans essentially stay the same. So I don't click anything here, and I press accept. So it's just going to put those 3 points that I did together, but it's not yet run a best fit analysis. So if you press next one more time, it does that. It takes a minute to run. It's pretty fast though. So you can sort of see it fitting here. Okay, and so what we're going to do is we're going to scroll through the scan, and we want to verify right here, that we have really intimate alignment. Now I can expand this window by pressing this icon here, and to scroll through the arch, you basically hold the right click and you just kind of move to the right and left. And what I'm doing is I'm looking for intimate kind of overlay. overlap all the way across. You can see the curved slice moving in this upper right hand area, and that looks great. So we're going to say continue with acceptable alignment. All right, so these next steps is pretty standard. So basically finding the nerves. So what I do is I'll start from the incisive foramen area, and then I start going forward until I lose the anterior loop. I just kind of lose it here. I'm going to mark it, and then I start moving back, mark it, mark the foramen itself. Ooh, that's hard to see. You can kind of see a little shadow here. So sometimes you have to kind of move back and forth until you find it again. Wow, that's quite difficult. So a lot of times I may just move all the way back and try to get some traction. So I can kind of see the nerve right here. That's the nerve right there. Sometimes you can also use this screen to help you identify where you're at. Okay, so there's the nerve there, right there. Let's come forward and follow it. I kind of see it now right there. So I'm going to click. And then you want the upper border of this yellow circle to really be in the upper border of your nerve. I mean, you want to basically mark that superior border. Okay, coming up, starting to see it better. I don't know if it's here or if it's here, but I'm going to mark the upper border. Granted, this isn't near my implant site, right? But just to be complete. Okay, lock that. And then next. All right, so it's asking to place a model tooth. I think we're going to step out first into expert mode. And we're going to turn off the CT data image. The hotkey for that is D. But we're going to right click on this jaw scan, and we're going to virtually extract this tooth. And so we're going to click on the tooth that we want to virtually extract. It does a pretty phenomenal job segmenting it in most cases. Okay, so select the tooth number, which is the target of the copy. Basically tell the computer what tooth this is. It's going to create a little Pontic site, and this is essentially I guess the vertical, how it's going to create the Pontic site. And press OK. And it's going to create that as a virtual pre-op. You can see this menu here. And now P is the hotkey for that, and that will turn on and off that tooth. All right, so now we'll step back into the wizard, and we will draw ourselves a little premolar here, and move forward. So tooth placement. So one of the things I really like about the integration, I guess, of ExoCAD and ExoPLAN is the digital wax up sort of library and the ease in which it's you can wax up a tooth. I just turned on and off the upper jaw. That's well, it's the antagonist jaw. In this case, it's the upper jaw, but it's the antagonist jaw. So the hotkey for that is A. You can also kind of click the eyeball button here to turn that on and off. All right, so let's see where we are. We can move this tooth sort of in the middle. It's definitely a little bit of a large tooth. We can bring it down some. One thing we'll have to decide, it's probably too far. It's a bit in crossbite. Some of the other keys that you'll notice is you'll still use the right button to rotate the model, the right mouse button. The left starts to move the tooth, and when you hold like Control, you can rotate the tooth completely, and it's sort of a push and pull. You can kind of grab it and push it and pull it. Shift, if you hold Shift with the left mouse, right, that makes it big and small. So let's decide if we want to make this tooth fill the entire site, which probably we do. Turn on the upper jaw again. So looking down the buccal corridor there, we'll move that a little bit to lingual. If this tooth was too wide, we could choose just to scale it in a buccal lingual direction, and we could narrow it a little bit like that, and then we could go back to the move tool and move, scale, rotate in all directions. That can help. In ExoPLAN, you lose some of the functionality of the wax ups. Now in ExoCAD Galway or 3.0, now you can do an automatic anatomy adjustment, and the tooth anatomy will automatically adjust to the antagonist or the patient's antagonist jaw. But you do not have that yet with this function. Okay, so let's look one more time. Still sort of poking through the maxillary mesh there. So maybe it lines up well in the buccal. Maybe we just drop this down some. Where does it go away? I guess that's the part we really want to know. Obviously the nice thing about this, right, is this is much more of a realistic diagnostic wax up. We're trying to see where this tooth can exist in the patient's dentition existing. So this is going to be sort of a conformative, more of a conformative plan. And let's change the scale again, buccal lingually, make this a little bit more realistic based on the patient's occlusion. Okay, that's starting to look better. A little bit prominent on the lingual. We may be able to rotate this over and improve that. Okay. All right, so now that that's done, we can see now the that the tooth on the sagittal slice. Let me click out of this for a second. So just as a review, find that digital wax up there. Okay. So you'll notice, so to move you can sort of zoom in on the section that you're on, and to move it bodily, you can click the middle mouse button, the middle mouse wheel. All right. So there's our digital wax up. There's our pre-op. If we click on and off, it will appear. I would like if the color coding of this menu matched the color coding of the hint. I think that would be a nice feature. That's something I really like about Blue Sky Bio, is you can dictate that. All right, so yes, we can choose our implant. So we have favorites that we place, but it could be any. There's a large library of implants that ExoPLAN is compatible with, and I'm sure it's growing. So I'm gonna stick with Zimmer Biomet. Always like to try for a platform switched situation. This being a wide site, I'm gonna initially pick a 5, and based on this image here, probably don't need a very long one because of the ample bone in between the primary tooth roots. So let's just start with 11.5. We can pretty easily adjust that. So in any screen, basically, you can place the implant and then start moving it. So I like to have what I just did is I clicked on Implant Control, and I like to have the curve cut. I don't really think the pano is helpful unless you have multiple implants, or I guess you could have the pano on and remove the implant axial and then turn this off. So basically, controls to move the implant, very similar to the controls to move a tooth. I'm going to turn off the CBCT for a moment, and I like to work off of the spin around the implant window, which is this lower one here. So we're going to move this tooth. You can press Control and the left mouse button, and you can move the tooth. It would be nice if this width here was adjustable, like it is on other softwares. So this basically shows the entire width of the implant, but it would be nice if it would maybe just show like an access channel, like 2 millimeters, for example. But this is great. So we're within the cortex. If you place an implant here, what's going to actually happen in real life is the cortical bone's probably going to push your drill over, and you probably will not actually run your implant right down that cortical plate, even with guided surgery. So you don't need to place it that close into the away from the buccal or the lingual, so you can kind of place it right in the middle, and it will follow that sweet spot nicely. Right now, the other reason why I like this spin around the implant is you can kind of create your own periapical view, and we're going to make some corrections here. That looks really good. I'd like the depth to be a little bit subcrustal. I think a really good rule of thumb is about 1.5 millimeters subcrustal. Usually that creates the space. So ideally, I want the implant 3 millimeters apical to the gingival zenith. On a posterior tooth, that might be a little too deep, but I certainly don't want it less than 2 millimeters apical to this tissue margin. And on anterior, the range in my world is about 3 or 4 millimeters apical to the gingival margin. That's where I'm placing my implant. So as soon as you start doing guided surgery, you start placing your implants much deeper probably than you ever did, or you're asking your surgeons to do that than they ever did before. So this tooth wax up, obviously this patient has a lot, because his baby tooth was retained, this patient has a lot of hard and soft tissue here. So we're going to have to do some, even though this could be flapless, it would be prudent for us to reflect a bit and also do some osseous, contouring. This may be a little deep, and so maybe I'll bring it up just a bit. I'll check that on that screen. How does that look there? Looks good. A little bit subcrustal, just a bit. So kind of splitting that difference, maybe not quite 1.5. Okay. Move it back there. All right, that looks good. So the next thing we might want to do is to unclick out of this large screen and get back to sort of the 3D model. It's always these window keys. So the other thing we want to look at is the hex position. So with this, with this implant brand, and you're gonna know your implant brand and its details, but with this, the surgical kit, the fixture mount, the drill fixture mount that attaches to the implant is based on the flat part of the hex. So I want to control the timing of the implant by placing the flat part of the hex straight through the buccal and lingual. So you can kind of see it. There's a lot going on this implant. I usually look at it from kind of this view. So you can see this is straight buccal lingual. So again, the surgeon's fixture mount is based on the flat part of the hex. So I want to time that to the facial, and the reason why we do this is oftentimes we are making a custom healing abutment, like a printed custom healing abutment. I guess a milled custom healing abutment on a tie base too, like a custom milled PMMA or acrylic healing abutment, or could be that you're actually making a provisional and you're going to do immediate loading, and so you want to create that provisional such that it actually fits the site from the start. So the way you do that is you dictate the timing in the digital plan, and then that carries over to the lab manufacturing as well. And then then the surgeon, all they have to do is approximate the notches on their fixture mount in this system, in this implant system, to the buccal, and a little bit of tweaking at time of surgery gets the restoration to fit correctly. So I'm going to leave it right there. That looks good. We'll press next. At this point, we're going to set the sleeve placement. So these notches here, essentially, if you're the one that places the sleeve. So I at this point, I never really changed this. I used to, but just to visually show it, if we were to line this flat up right there with these notches on the sleeve, essentially that's how it's made. That's how it's going to look in real life. So the surgeon's going to have this glued in to the surgical guide, and they're going to stop. Their fixture mount notch is going to sort of line up with this imaginary line here, and that's going to be the correct position of the implant. So this all looks good. Press next. So this is the prolongation. So short, that's long. Short, long. A lot of times on anterior teeth, you have to use long prolongation, but a short prolongation or a short offset is always going to be more accurate, because the distance from the top of your guide tube to the tip of your implant is shorter. So there's less room for angular error there. All right, press next. So the way ExoPLAN is set up, we have to confirm this planning. And every time you make a change, you have to go back and reconfirm the planning, which is really, I don't know. I think that should be at the end, like at the very, very, very end, perhaps, or there some part of that workflow is not so good. Okay, so here we are. That's done. This is now ready to, you know, review with your surgeon if you were doing that, review with your dentist, or you've already done it yourself. And then this is ready to design the guide. Okay, so this is your radial sleeve offset. This is basically printer specific. So whatever printer you're using, if this is the first time you're using you know, this printer or this program with your printer, or you're sending it to a new lab, you know, this should be worked out. If you have your own printer in your office and there are these printer presets, you can essentially run a few cases initially when you first start, run a few cases and figure out what fit equals success. So you want the guide tube to not be too tight and not be too loose. And generally we glue them in. And this is our radial sleeve offset that we use, but it's going to be different for you. And if you're sending to a new lab, if for some reason you're making the guide if you're designing the guide, you're going to want to know what their you'll have to probably run some tests to see what fits. So here, this is a custom implant rotation marker either on the corner or on the flat part. So, you know, do I want my marker on the flat part or the corner? Now, unfortunately, this comes out so small in real life that it's almost impossible to see on the surgical guide, so I've stopped doing this. But if this were bigger, this would allow you, this would be a printed marker that would allow you to line up the guide tube more precisely. At this point, I essentially have to eyeball the alignment of the guide tube, but that's the intent, but this is too small. All right. And we don't have to change anything else, so we'll press next. Essentially, this is the insertion direction. Sometimes you change it, but if you do change it, let's say I change it a little bit, you'll click Set Insertion Direction from View, and then you can press Apply, but if you press Next, it does two things at once, and it moves you to the next step. But you have to set Insertion Direction from View in order to change your insertion direction. So what it's doing is it's running, in this case 0.1, and it's so that the guide fits better. ExoPLAN / ExoCAD. This is the same design surgical guide bottoms. This is the same as designing, you know, occlusal guard bottoms. It's the same program. So for this surgical guide, I don't like to run the distal extension of the surgical guide through an embrasure. I like to have it come from down to a cusp. I'm going to run it at the gingival margin, right around here. I like to extend it on a posterior guide. I like to extend it so you're sort of rounding this corner a little bit. If it's too minimal, the guide is a little bit unstable and it can rock. So by starting to create, you know, run this guide around, you're gonna gain a lot of stability in your guide. Double click to close. You can go back and make adjustments on your points. Maybe I put this a little too far down the lingual. I like to have the palate or the lingual a little thicker on one side than the other. Okay. Basically, you need space for a window and you need space for text. And so if you can accomplish that, you're good. You don't have to press apply. You can just press next. It's going to create the guide. It's going to automatically start to create windows. So we're going to create a seating window here. These bubble points can control this window. I'm left clicking on those. This is actually kind of a handy tool to spin it, and then you can set the depth. You can also use your normal control and left click to rotate this box around as well. Okay, so I want to make sure it's fully like within the guide. It's not like this, for example. It's far enough down, but it's not too far down that it's creating thinness and weakness in the guide. I can run a preview and I can see this CUSS tip. So this happens a lot on posterior teeth. I'm going to bring this guide, this window down a little bit more. See if I can show this. Okay, so if you see these islands, let's say this entire cusp was showing, but you had these islands of resin or print material, that would throw a warning. So you don't necessarily want to have an island. You either have to lower your window farther down, or in this case, I'm going to bring it up. Okay, I like that. Probably only have one window on this case, but I could do another one by adding new. Put it here. Use control. We'll rotate. Use control and left click, and we'll set it this way. You can kind of see this purple area. It's sort of previewing right here that I'm going to have a little resin. Let me bring it up so you can see that more. See that resin sticking up? So you can kind of see that. So I'm going to bring this down a bit, and now I don't have any. You can click preview to confirm. I also don't like how this is sort of weakening this situation, so I'm going to bring this more like that. That looks good. I like to deboss versus emboss. It prints better. Actually, I think that default was fine because it is tooth number 20. So once it turns purple, you can click it on with the left click onto the guide and then control to sort of rotate it and move it around, and that looks great. And we'll press next, and it's going to create the guide, but it still allows us to edit the guide in this screen. So this is large region and small region. You essentially want to make sure that your guide donut doesn't have any voids underneath it, has nice support from resin. This is a little thin. That actually makes me a little nervous. That could potentially break. We could use a regional move tool, but it might be better to take an add tool from Freeform and go in here and strengthen this up and create a bit of a bar with the add tool. Get that a little larger. So you don't have to worry about adding to the top of your donut. You can't do that, but you can add to the side, and then you can take your smoothing tool and just make that a little wider, and that should add some more strength so that can't crack. Okay, this is good. You press next, it's going to merge that part and output this guide file to your patient's folder, and you're done. Thank you.